Joining me now is Congressman Peter Welch, a Democrat from Vermont. Congressman, thanks so much for your time this afternoon.
Thank you.
So why do you think that 39 of your Democratic colleagues voted for the Upton bill in the House that just passed?
Well, it's what the president just said. He did fumble the rollout. He had promised people that if they had insurance, they could keep it. And I think those folks had a very politically difficult situation and wanted to err on the side of saying that they wanted a president to keep his promise. The fact is the president has laid out another administrative proposal that will allow him to keep his promise. But that's why. I think it was a political decision by the president and also by many of the members in those votes.
But then doesn't that undermine one of the key goals of the Affordable Care Act, which is not just to make sure that more people are covered, but that they have more quality coverage, and some of these plans, as determined by the ACA, are substandard?
Well, it does in the long run, but that's why it's a year program, and it has to be done on a practical level as a transition. You know, when the president spoke about allowing people to keep their health care, the number of people relative to the overall number of Americans was going to be relatively small. Obviously, it's very important to them. And it's not, quote, perfect policy to allow those plans to continue. But on the other hand, when you're making a major change, it makes sense just on a practical level to have some transition steps to get you from here to there. It can't just be all abrupt. So, yes, it's not perfect policy. But on the other hand, it makes sense, I think, for fairness and implementation.
Is there a concern that piecemeal legislation like this could ultimately chip away at a lot of the key goals of the legislation?
You know, when it's to fix for transition reasons, I don't think so. I mean, if you totally unravel the individual mandate, which was what the Republicans were holding out for when they shut the government down and threatened to default, that would have completely unraveled the design of it. But there's practical issues for implementation where, in fact, if we were in a more functional Congress, now that health care is the law, both sides would be saying, all right, let's make this adjustment in order to allow it to work. And we'd be making practical adjustments, just like bipartisan members of Congress did when we were doing Medicare, when we were doing prescription drug Part D, which was a Bush program, which previous Congresses did with Social Security. We lack that cooperation now. You know, the Republicans have had essentially a fight for failure against Obamacare. And it's been a pitched battle without retreat, and it's unrelenting. So that makes it difficult to just have some cooperation on implementation issues, which would make things better for all Americans, even if you're somebody who doesn't support the health care bill.
Now, this week, the president said that insurers should temporarily restore canceled plans, but he said that without talking to the insurance companies first. Just the latest gaffe. What do you think the White House needs to do right now from this point moving forward to get this thing on the right track?
Well, you know, first of all, let me say this. The insurance companies are big winners in this. You know, this health care plan is essentially a Republican-designed plan. It was modeled after what Governor Romney did in Massachusetts. And that model was a private, for-profit, insurance-based plan. There were a lot of Democrats who didn't particularly like that, me among them. But, you know, the insurance companies are going to get 30 to 49 million new customers. So if the president makes a suggestion that might help us in the transition, I think it's fair for the insurance companies to remember that they're the big winners in this and do their part.
And what else do you think the White House needs to do moving forward to get this thing on the right track? I mean, admittedly, they've just made gaffe after gaffe after gaffe here.
Yeah, whatever they say doesn't mean much. It's what they do. And this is all about implementation. I mean, good implementation is good politics. And the reason a lot of the Democrats are so upset is because we've supported the law. And since we support the law, we know in order for it to work, it has to be implemented well. And, of course, that's an executive function. So this is about implementation, smoothing out these wrinkles, acknowledging directly and candidly when there's an implementation issue, and then taking on the responsibility energetically to fix it ASAP.
And while you're speaking of implementation, we're showing the healthcare.gov website. And the president has said at times, though it's not something that he's repeated often, that, you know, people can sign up on the phone, they can sign up in person. Now you're hearing suggestions that perhaps they can go directly to the insurance companies to sign up. How key do you think the website working properly is to the implementation, the successful implementation of this law? Does all of it hinge on the website, or are there plan Bs and Cs, if you will, to make this still work?
We can't succeed without a very functional website. And then we want supplemental opportunities for folks who just don't like to go on the internet. And that's a lot of older Americans. But, you know, we have to have that website that's functional. We've got a Social Security website that really works. So it can be done. So, no, we've got to get that website functioning.
All right, Congressman Peter Welch, thank you so much for your time this afternoon, sir.
Thank you.
On